All right. There we go. That's more like it. I don't know. Sorry about that, guys. I don't know what was that interference almost. It was weird, but we're back and we're live and I don't know. I might have to go back to the nighttime session because the afternoons are like I'm like, the time just gets away from me and when I'm with clients, I can't just like stop and go live. So I don't know. I might just have to do this the 30-day challenge and you guys, catch me when on the replay, which is fine, which is probably most of you are watching this on the replay anyway, but but I'm definitely committed to coming in every day for the next 30 days. We're on day 9 and we just today's podcast just aired as well. Politics and bias. And no, the episode is not just all talking about politics. It's talking about politics in as how it refers to healthcare. And I'm not talking about the administration. I'm talking more about what politics looks like in the hospital. So make sure you go ahead over and tune in. You can tune into Apple, iHeart, Spotify. We're even on YouTube for those who are more visual listeners. So those who like to look at the podcast, you can definitely do that on YouTube. Nurses with Voices, check it out. Now, but what I wanted to talk about today, you may see on the screen, depending on where you're watching. Today's day 9, and I want to talk about how nurses can replace their income. Now, when we think about inflation, right, and I was thinking about this, when we think about inflation, we get about a 3%, right? About 3.5%, you'll say, of a annual raise in your salary. Now, when you look at what your annual raise might be, and let me get a calculator out. So let's just say as a nurse, you make about, let's say you make $90,000 a year as a nurse, and you get a 3% raise. All right, you get a 3% raise. So that's about $2,700. So now you make $92,700, right, a year. That's your 3% income. Now, what if I told you that you can make that in 6 months? Are you listening yet? I mean, I say this to say because we've done all the things. And I talked about this on my podcast, not the annual salary piece of it, but today's podcast will talk about how we've done all the things, right? We go and we get the degrees, we get the certifications, we do all of these things, and we work our way up the ladder so that we can get a pay increase, and so that we can sit at certain tables. And we don't consider, or maybe sometimes we do, and sometimes some nurses are starting to consider this, creating our own table. And once we create our own table, the skies can be the limit. And I'll give you an example. I've had speakers from the Health Wealth Expo come on and speak live. And you've heard from Dr. Helen Fossum, who's going to be speaking on medical writing and what you can make as a medical writer. I don't think people realize that when you go to community centers, when you go to different doctor's offices, those brochures and pamphlets that you see, those was made by a medical writer. And you can make anywhere from $90 to $250 an hour just from being a medical writer. And this is how you can replace your income so that you're not working 5 and 6 shifts a week, right? You can do that just by being a medical writer. You can start a mental health practice as a nurse practitioner. And this is something that Dr. Linda Logan is going to be talking about at the Health Wealth Expo Live Summit, talking about how she went from $0 to 50K months, right? Now, let's just say you started a wellness business, right? You started IV hydration, or you started a wellness business, and maybe you offer weight loss services. Let's just say now let's go back to that example of making $92,700 a year, which isn't a bad salary. It isn't. It's not it's not a bad salary. Definitely, it's livable. But that's just it. It's livable, and we're working to make 3.5% annual raises where we can create our own tables and make what we want. And when I say that is in 6 months, let's just say you offer weight loss services like I do. All you would need is 15 clients to be able to replace your annual salary. 15 clients offer one service that you charge $1,000. So you have that one weight loss service, and you have each client, the service, say it's about $1,000. All you need is 15 clients in 6 months, and you've just replaced your annual salary of $92,700 a year. So these are the type of things that we'll be talking about at the Health and Wealth Expo, and we'll be breaking it down. I started off with a IV hydration business, and I've expanded my services. And IV hydration is the same thing. You can do the same thing with an IV hydration business now. And I'll tell you about how I started my business. I'll break it down really quickly. Not too much of a breakdown, because again, we're going to be talking about this at the Health and Wealth Expo. The American IV Association, I think we announced that yesterday or the day before. They're actually going to be at the Health and Wealth Expo with an attorney and talking about starting an IV hydration business. And one of the things that you need, if you're a nurse, so you have to battle, right? And in some states, you don't really even need to be a nurse, as long as you have the right people in place. But we'll get to that. I won't go into too much of that. But one thing that you want to consider when you want to start an IV hydration business is that certain states are what we call corporate practice of medicine. And what that basically means is, a non-physician can't own a business, or can't own a medical practice, I should say, because when you're starting these businesses, they are medical practices. And this is where the attorney comes into play. And this is why I love that we're having the American IV Association at the Health and Wealth Expo, because they're going to break that down and, really talk about what that means, and really go into management service agreements and MSOs, MSAs, and really talk about what these things mean. And for those of you who already have your IV hydration businesses or your wellness, but you already know what I'm talking about, your aesthetic businesses. But we're going to be breaking that down at the expos. And, once you have these things in place, you want to have your businesses in place properly. And something that I have asked the American IV Association, I said, everyone's there, not going to be just starting an IV hydration business. And the feedback was, that's okay, because we're going to be going over the healthcare law, right? We're going to be going over the healthcare law to make sure that you are putting your business into place so properly. Now, that is something that I'm truly, truly excited about, and I wanted to come on. And this is how we break through from burnout, right? And this is how we go from burnout to wealth building, making sure we have the right steps, making sure we understand the laws, because I know we may say, start a business. Okay, well, how do I do that? And I'm going to talk about that tomorrow. Tomorrow, I'll talk about, your LLCs. And again, this is more attorney things, so I don't want to get too much into that. But I will talk about how easy it is to, get your EIN, right? Like things like that, things that you can easily do in like 2 seconds. And so I'll talk about that tomorrow. And I'm looking forward to seeing you guys at the Health and Wealth Expo Live Summit, May 15th and 16th. If you have not received your ticket yet, log on to healthandwealthexpolive.com. And I will see you guys. I'll see you tomorrow, but I can't wait to see you at the summit. So talk soon. Bye.